this is when you know you're going to make a stop at the gas station to fill up the tank. I think the consistency and frequency is probably more where the impact is going to be. We know that exercise itself is pro-inflammatory, but in a good way. But if you look at the bigger picture of things, recovery is still part of performance enhancement.
This is Augmented Wellness. Today, we speak with Lloyd Camper, sports medicine physician, longevity expert, Cenegenics medical director. A conversation about the human body, performance, and how to live better.
Welcome to another episode of Augmented Wellness. I'm here with Dr. Camper. Very excited to speak with you. I got the pleasure of meeting you. I guess it was a year almost already.
Yes, time flies.
Time flies. And we got to get to know each other, get to know how you see the future of medicine. So I'm excited to cover some of it today and even look at some of my own data that we got to collect together. So to get started, I would like to go all the way back. You were an athlete, and how did you go from I guess being a practitioner of medicine or in yourself to then care for others?
Well, first, very happy to be here. Thank you for the invitation, Demian. Yes, it's been a year since we met, and since then, we've been looking more into longevity and ways to keep on improving the field now. Currently a practitioner, but as you mentioned, I started as an athlete, played basketball in high school and then run track for college. And so, through the discovery on my own body and injuries and going through, physical hardships, I want to say, this is where I had to find and kind of dig deeper into what does it mean to be, one, to be an athlete, two, to be healthy and to be in shape, and then three, what is going to be, in what direction is my life and my career going to go. And so that's where I started making the transition towards medicine.
Yeah, sports medicine in particular, you obviously as an athlete, you got to see probably your own journey, right? How do you see sports medicine versus other medicine practices or approaches? And, is there anything you see earlier from the point of view of an athlete, given that obviously they are probably more intense in not only doing things, but also even in today's world, collecting more data and seeing things that others may not?
That's a great question. So as a sports medicine physician, I really feel like we are, in a way, prescribing life, right? We know that exercise prescription is one of the best things that we can prescribe to patients. It's really a lifestyle improvement, and this is really, in a way, the secret to a healthy life. Besides, the traditional approach to medicine where we are diagnosing illnesses and creating treatments and therapies, exercise really comes at the forefront of preventative medicine. So instead of diagnosing illness, we're trying to promote health and keeping patients or just everyday people healthy. And so with the sports medicine background, it's not about seeing anything early, but it's about having proactive, I want to say habits, healthy habits. And so, sure, we can diagnose illnesses, sports medicine or musculoskeletal diagnosis, but when there aren't any chronic pathologies, the main goal, I would say, is to really retain healthy levels, healthy markers.
Actually, let's talk about a little bit the connection between athletes and elite executives, or elite athletes and top performing executives. How do you see that transition, that connection? How things change probably from when you started in your career, and then let's then go into Cenegenics and how you approach it from the institutional level.
Absolutely. So we're seeing a big mainstream wave headed towards longevity ever since the pandemic of COVID and the population in general realizing that they're not as healthy as they might thought they were. And so now we're seeing executive caring about their health and just being more, I want to say, just physically active, which is an kind of easy way to start into longevity. And so this is the time when I just finished training in sports medicine and decided to join a longevity practice, which is Cenegenics, one of the pioneer in the field of longevity, previously called anti-aging, now really focusing into, I think the difference between anti-aging and longevity really is the performance addition to that. The anti-aging had a lot of maintaining and just kind of preventing the decline that we expect to have in the aging. But now with the longevity, is really pushing the boundaries of what we would call healthspan, where patients want to increase their capabilities of functionality, their strength, their endurance, their cognitive function as well. So those are all the different components of longevity. And so at Cenegenics, this is where we are really creating a baseline, a full evaluation to see what is the patient's initial health status to begin with, and then to see, based on their goals and based on the findings, based on their history and what they're trying to accomplish, we're creating really individualized plans where, as I mentioned, we would try to target performance, longevity that is physical and cognitive.
Yeah, we're going to get into that. I got to get a little bit of a glimpse of what that is, so maybe we could see some of my experience doing that. But let's go a little deeper. So, for people that haven't been in an office such as yours that has amazing equipment to measure, how would you characterize, the approach that you have versus a traditional, let's say, doctor, primary care? Right now there is there's a lot of confusion as to, what a person needs to have in order to really assess how they are. And unfortunately, there's this, this way of people saying that doctors are not doing enough, which I think is unfair. Traditional doctors, obviously, they're constrained by, the way the system works. And sometimes they, insurance and how insurance covers things. So how do you see that? And mostly so also individuals know how they should be thinking about potentially even becoming a patient of yours in Cenegenics.
Right. So the way medicine works nowadays, it's not the doctor's fault in which of, doing wrong by the patients. The doctors are always looking for improving the patient's health. The issue is, what are we testing for? What are we trying to diagnose? And what is our plan, right? So I like to give the analogy of your gas tank in the car, right? So the way that it works is you have the empty and you have the full part of the tank. And so you're going to be driving your car around and everything is going to be fine all the way until the needle reaches the empty sign and the light comes on. This is when you know you're going to make a stop at the gas station to fill up the tank. The way that medicine is practiced is that nothing is going to happen until that light comes on and the needle is on the empty sign. That's when you're calling your doctor, or that's when you're going to the emergency room because a light came on, something happened, and you know you need to address it. And then this is when insurances kicks in. This is when doctors are able to operate because we are trained and educated to kind of detect when the light comes on and to be able to, at that point, have an intervention. But now it's a different approach with longevity. We're really looking for optimal performance. And so we want to stay away from that empty gas tank. So we want our tank to be at least half full, if not full, at all times. So that this is the longevity approach and perspective. And at that point, it's a completely different perspective from a physician because you're looking for healthy markers and wanted to keep healthy markers. And so we're not trained to detect health. We're trained to detect illness. And that's where here with Cenegenics, we're starting to, not starting to, but we have been measuring markers for decades and compiling a database that is showing with our most successful patients what has made it successful in their health span and their performance. And so this is where they're particular markers that are now becoming a little more popular, I want to say, in the longevity space, things like VO2 max, body composition, and then all the blood biomarkers that you might find testing for in terms of inflammations and lipoproteins and those kind of markers. But it's really a comprehensive approach. Going back to the car analogy, and I'm sorry for people that are not car people, but it's like you might not have a light coming on for the tires running low or the threads of the tires running low, even though you will need a tire change. This is the really comprehensiveness of the human body and really looking from all different angles. It's not just the blood work. It's not just the VO2 max. So it's not just one biometric or one biomarker. It's the totality of it and really being able to assess, evaluate, and come up with a plan of what needs to be done to maintain those healthy markers.
Yeah. But going to biomarkers, for example, which is obviously something we talked a lot. I mean, at Betterness, we offer quite a large set of biomarkers, and our goal is to make it accessible, right? So people could get a measure. Obviously, understanding that it needs to be interpreted by a doctor, especially if something is a little bit out of range. But there's no denying that the world in biomarker world has changed over the last 3 or 4 years. Companies like Function Health have really democratized it, and really has lowered the cost, right, of accessing this. How would you characterize the importance of at least getting that blood work done at least once a year, a couple times a year, to at least see if there's some things that point. I have a lot of friends that say, "Oh, I'm feeling this. Can I get some blood work done?" And I'm like, "Yeah, you should get it. See if something comes out, and then go talk to a doctor." But how do you see it in the context of at least getting some type of signal in, better than none?
Absolutely. Again, you don't know what you don't know, and sometimes we would say ignorance is bliss. But when it comes to your own health, you don't want to be blindsided by any unhealthy developments or illnesses. And so you might clinically or physically feel good, but you might still be developing an early metabolic dysfunction. And so blood work is very important. The traditional medicine approach is still recommending at least a yearly exam or physical. And so along those lines, that's still a baseline to do an evaluation, and you can push it to further biomarkers, not just the basic ones that has been done from the traditional practice approach, but kind of pushing it further to look into inflammations, to look into early cancer, to look into early, again, metabolic dysfunction. And so if everything looks good, then sure, you can do it on a yearly basis. But now if you find something that you might want to address early on, there goes the frequency changes. If you want to do it more often, every 3 months, every 6 months. And so, yes, in the longevity space and at Cenegenics or any other practices of longevity, we are pushing to address any kind of dysfunction earlier rather than later.
How have you seen this change over the last 2 or 3 years? Because I would imagine that today a lot more people come to you already with their blood work done. I'm probably now with GPT and all these, with an opinion. How do you see it? Do you see it? Is it better? Is it worse? Obviously, they come already with some point of view. I would say versus before, right?
It has become much more accessible, absolutely, and I think it's for the greater good of the patients. Like I said earlier, if you don't test for it, you won't know about it, and unfortunately, a lot of the issues with medicine comes with the later discoveries of any dysfunctions. And so, as we know, that the more impact or the more developed an illness is, the harder it might be to address and to reverse or to treat. And so now having all this access to early testing, the general population is being more involved and interested into their own health, their own biomarkers, it could lead to maybe more anxiety, more confusions, more questions. But it is, I believe, to the best interest in those patients' health, especially at an individual level. If you're going to ChatGPT or Google any of your own personal findings, ultimately all those database, AI or internet-driven are still going to compare you to the general population, but you might just be the exception to the rule. And so at that point, that's where the medical expertise becomes very important, because it is a comprehensive assessment. It's not just this one finding that for you might seem borderline abnormal. For ChatGPT, it might seem just borderline abnormal, but then having a medical expertise looking at history, doing an actual physical exam of you as a human being, an individual in front of a physician, might find it more important and to be addressed, or vice versa, just not important and something just to monitor or just bring up reassurance from the physician's standpoint.
Obviously, there are all different type of tests, right? So we have now also pretty accessible the full body MRIs. A friend of mine, he created a company called Ezra, and they merged with Function, and they got an FDA approved $500 scan. Obviously, it's not like the full MRI, but as you said, it's better than nothing. And at a $500, if it discovers something, it could be very important. How do you see, sort of in the broadly speaking, MRIs, genetic testing? How do you see? What is your view on that? I know in genetic tests, I'm not an expert, but I know that there's a lot of controversy regarding certain genetic tests. Anything to share with the audience on sort of, what would you do for yourself?
That's a great question. So there's a lot of technological advancement that are coming out, and the space, as you mentioned, is starting to have a lot of players involved for it being imaging, genetic testing, even biomarkers. Now, I would say I come from a background of traditional medicine where too much information might not be good information, but that is, again, potentially going against the greater good of the patient. Now, you have to know what to do with that information. You need to bring it up to an expert. So if you're going to go on your own as a patient, as an individual, and get those full body MRI testing or those genetic testing, it could become a major anxiety-driven results if you don't know how to interpret it. And like I mentioned earlier, ChatGPT and Google and all those AI tools might not give you the appropriate answer at that point in time, knowing that there's really a factor of mental health and associated with all of this. And there's not many tools or as we mentioned, technological advancement really measuring mental health. And anxiety and stress are very prominent in today's society. And as you know, I believe you used to have a ketamine practice. And so that, again, is a great practice that is also is developing the field of mental health and cognitive management. But we really want to utilize all those tools that are coming up to us in an efficient manner and beneficial manner for the patients without causing other issues. So what I would do for myself is, probably testing a little bit of everything to really also potentially test one machine against or one results against another one, and to seeing the accuracy of it, because you might do the same genetic testing and find two different results, or the same imaging test and find two different results as well. And so that's where there's some inaccuracies there that needs to be addressed and reviewed by, again, an expert in the field. So just testing all the different tools, knowing your body, knowing your baseline, and run all of this by an expert.
So let's move more into action. I know recently we talked a little about stem cells, and in Florida being an interesting state, given the way they approach it? Educate us a little bit on how you see it. What have you seen success in, and how is Cenegenics being involved in that new sort of care section?
Yeah, so stem cells is actually part of a very broad term, part of what we call the regenerative field. From a sports medicine or orthobiologic standpoint, what has shown a lot of initial development in this field is actually PRP, platelet-rich plasma, that has driven a lot of advancement when it comes to joint healing and joint repairs. Now, there's been, again, this very popular move towards stem cells, or MSCs, mesenchymal stem cells, or messaging signaling cells, which right now the research and the science is really trying to evaluate the benefits it has, the advantage potentially above PRP. PRP being a blood-driven biologic that comes from the patient itself, re-injected in the same patient. Now, there's been a lot of what we call allogenic stem cells coming from umbilical cord donors, where cells have been collected, harvested, and grown or maintained to really re-inject into patients to create, again, this regenerative, this healing or anti-inflammatory effect onto the patients. And so, yes, Florida has created this, I want to say, this advancement here in the U.S., where instead of going internationally for patients who could afford it, looking into this new technology of therapeutics to potentially have a shot at it here in the U.S. So at Cenegenics, we started offering those services here. Again, those are not FDA-approved treatments, and the evidence behind it is, I would say, a little bit past anecdotal, because it's been used for decades in certain clinics and certain practices, but it still didn't create very solid, what we call RCTs, or randomized controlled trial. The issue, though, with randomized controlled trial, again, it comes to a population or generalization kind of testing results and data. Now that we're moving more towards the longevity performance medicine, we are in more of an individualized care. Like I said, something that might work for the general population might not work for that one individual, being the exception to the rule. And so this is the approach that we have to have in those practices, where we have to have this consent with the patient, understanding that this is not a federally approved therapy, and it might have the most robust data. It has done, I would say, tremendous benefits for certain patients, and for others, it might not have created the expected outcome. And so I think with this understanding with the patients, that's where now we can actually create the data that needs to be created for this regenerative space. And so, as I mentioned, there's the umbilical cord stem cells, which is the one that is... Which,
by the way, I've been paying for 15 years now for my daughter for storing them. And so, yeah, for example, so tell me about that. I have it. What is there a real use for it? What is the type of use that, for example, potentially someone could use the store?
Yeah, so again, you mentioning storing, so we're talking more autologous, so using your own stem cells, the patient's own stem cells.
My daughter's been storing.
Right, or your daughter's, she would use her own stem cells, and
Can I use it, for example, her mom?
No, you would not be able to use somebody else's stem cells because of the risk of cross-reaction and lack of matching there. But yes, you could also harvest your own stem cells, which could be from bone marrow or fat cells, and use that, to multiple indication. The indication, as your question is, why would we use stem cells? So there's multiple indication. It could be from a joint healing standpoint, where we would do more of an intra-articular intervention there, and the goal here is to create healing, decreasing inflammation locally. But we also could have more of a systemic impact if we wanted to do IV therapy or intravenous therapy. in that sense, same thing, the indication could be targeting inflammation. And we know inflammation is behind a lot of pathologies, causing metabolic dysfunction, causing pain, causing ultimately potentially cancer, being a complete dysfunctioning of the cell growth and cell apoptosis at that point. So if you're able to mitigate or control systemic inflammation, those are the possible benefits from using these stem cells or regenerative therapies.
So let's move into a more fun part. As you know, I'm a geek. I like to show things up. So let's talk about longevity and some of the actual measures that we've been talking about a lot between ourselves, like DEXA scan, VO2 max, which are a good complement, I would say, to biomarkers and things that are pretty accessible. So what would you say is the baseline that someone looking for longevity should be looking to at least get an understanding of where they are? What would be those measures?
My thoughts and practice really still revolves around a comprehensive approach, right? It's just there's not one measurement, not one metric that will tell you kind of everything you need to know. If you go to your doctor for your physical exam, we're not just going to look at your blood pressure and say everything is fine. See you next year. So this is the same concept here. When it comes to biometrics and biomarkers, we will still have the baseline vitals. So your blood pressure, your heart rate.
I'm going to actually play a little bit of a video, see as we go through it. So maybe you could, this is when I visited. But maybe we could walk into like what are the type of equipment that we're seeing there?
Yeah, so this is the DEXA scan. So this is for body composition. So again, in addition to your vitals, we believe that your body composition is another very important vital because this is your machine, this is your engine that you're utilizing every day, right? You use your body to function. So we're looking at your lean mass, your muscle mass, and we're looking at your bone density. So here you go. This is you being scanned. And so the next machine here is your VO2 max machine. So as we talked about vitals such as your blood pressure and heart rate, this here is really looking at your oxygen consumption. And so this is our own gas, right? This is our fuel. This is what we're utilizing to live every day. We breathe in oxygen, utilizing through our muscles, and then breathe out the carbon dioxide. And so this machine is able to tell us by measuring your heart effort and your oxygen consumption, what is the efficiency of your own machine. So with both the DEXA scan and the VO2 max, we're able to see a pretty good body composition when it comes to lean mass, bone density, fat mass, and then combine that with the efficiency that this machine has, right? How good are your muscles and your heart into utilizing the oxygen that you're breathing every day? And so, again, we obviously want higher markers for your oxygen consumption and your VO2 max.
Yeah, I actually fed the report into here, Bett-i. And something interesting. I just love how interpret is says my bone density is a bright spot, and it goes into some of the aspects here. What was interesting. Actually, why don't we talk to Bett-i, see what how she interprets this for us.
All right, let me pull this together. The biggest win, your bone density is above average. That's a real bright spot. The one thing to focus on today, get that rib asymmetry checked out by your physician. Any questions about anything we covered, or are you good?
I'm good. Give me a little bit more. I'm here with Dr. Camper, who's a physician. Tell me a little bit more what I should be focusing on. My asymmetry, I don't know what that means.
Sure. Let me clarify. The report flagged a difference in the density or shape of one rib compared to the others. It could be structural or related to bone health. The next step is getting a physician's assessment to understand what's behind that asymmetry.
Thank you. So that was my
agent.
The agent in the DEXA scan. So here, it had some of the measurements, right? So let's talk a little bit about what the DEXA scan measures, right? It measures bone density, fat tissue, right?
It will measure your bone density. We have a higher focus on your hips and your spine, right? So she just mentioned rib asymmetry. That could have been a possible rib contusion or injuries that you might have had in the past or fracture. That, with the healing, we know once any kind of body area is scarred or is healed, is going to be a difference with the normal tissue. And so that's potentially what was picked up. But the biggest emphasis is going to be on hips and spine because we know those are a very central part of our bones. They're very important in terms of mobility. As I tell my patients, if you break your wrist, that's not going to get you bedbound and kind of create some health, mortality, or morbidity issues compared to having a hip fracture or a spine fracture. Especially the older we get, there's a much higher risk of decomposition and illness and death, pretty much.
One of the interesting parts, and again, not to obviously, I think Bett-i's amazing and the thing it does, but what I really like how it connects the dots across things. Like if you're just looking at the DEXA scan. So as I was looking, I literally uploaded this morning. I started looking at my GLP-1 and it flagged that the caloric restriction might, reduce my mechanical load, and that might, something to consider given, the DEXA. I have a little bit of decline in testosterone I get from labs to labs and some elevated estradiol. So that might be something to look at. And definitely she's always concerned about my lack of sleep, which elevates my cortisol. And that increases bone resorption. So interesting, how as you bring different type of data sets together, you could start, seeing a fuller picture than just one. And with that, I'm going to move into the VO2 max one. I also loaded the VO2 max, and it says I'm in the top 30 to 35% of my age. But I do have some CAC. There. So it says that I need to, and I have a low HRV, which is something I personally have been very concerned about. Let's talk to a biohacker just for a second, see what it says.
Great. Let's dive into your report. The headline here is exciting. Your VO2 max is measured at 41.5, placing you in the top 30 to 35% for your age. That's a solid fitness win. However, there are some signals to watch. Your low heart rate variability and elevated resting heart rate stand out against a CAC 76 background. This suggests that while you're physically fit, your autonomic nervous system might need some attention too. Do you want to hear more about what this could mean, or shall we move on to the next section?
I'm here with Dr. Camper, who's helping me sort through this. Anything that we should ask here, the biohacker, about advice?
Is that a question for me?
Yeah.
So, we're talking about HRV, and again, I like to point out the comprehensiveness of all those testing. Like, you just don't go to your primary care to just look at your blood pressure. You can't just look at your VO2 and HRV. And you brought up the sleep deprivation potentially from sleeping 5 hours. That's another metric that now, thankfully to the wearables, we're able to collect, and things like Betterness really have this one place to combine all of your results. I suspect here your HRV is probably related to the lack of sleep as well. We know that if your recovery is not adequate when it comes to sleep, your heart rate variability is going to be impacted there.
One interesting thing is, talking about measuring, is the difference between measurements from different devices. So, biohacker, can you tell me what the difference is between my HRV and 8 sleep and other measures? Do you have that information?
Absolutely. Let's unpack this together. Your low HRV alongside an elevated resting heart rate, especially against the backdrop of a strong VO2 max score, suggests that while your cardiovascular fitness, your autonomic nervous system might be under some stress. This could very well be linked to your sleep deprivation. Getting only 5 hours of sleep can significantly impact HRV, as you mentioned. To address your question about the difference between HRV measurements from different devices, it's important to note that while the core principle of HRV is consistent, the algorithms and sensors used by different devices can vary, leading to slightly different readings. For instance, some devices might place more emphasis on certain frequency bands or use different methods to filter out noise. Given that, It would be insightful to compare the specific metrics each device reports and understand their methodologies. This can help contextualize your results better and guide any necessary adjustments in your recovery strategies. Would you like to continue to the next section to explore more insights?
And I think we're good. But thank you. It's very insightful. I actually love how he stayed quiet while we were talking.
Yeah, no, he was able to collect. No, I love these tools here. And so, again, this is a developing field.
Yeah.
And so all those different wearables and technology development, as I mentioned, I would test each one of them and almost compare it one to another and to seeing, the different benefits. Being a field in development, there is no gold standard at this point in time. We can't say that one specific wearable, one specific imaging, or one specific biomarker or labs to use the biomarker is the one that will give you the true results or the true meaning of your test. And so, again, I think having AI and having those tools to really combine, measure one against the other, and collect will ultimately give us maybe not a gold standard, but an understanding of, utilizing different results and analyzing, synthesizing everything together and just have, I would say, not a completely clear picture, but not so blurry of a picture of all of the results. And ultimately the goal is to have a plan of action from all those testing, all those results, and for hopefully have, a plan that is not deviating based on one of those wearables, and that we're able to really keep the plan forward towards something.
Because
unified.
For example, I had a colleague, friend, investor, Martin Varsavsky, and we talked about, the measurement as a motivating factor, right? Like, for example, I'm seeing here my VO2 max at 42 is saying it's good. I know we discussed it and it was pretty good, given that I really have not been focused on my health so much because of all the work. But now I have a measure. Now I want to improve it, right? How, for example, VO2 max, what can you do to improve it? I mean, what are the techniques, and what should you be expecting? It's like 42. Can you be at 46? How hard is it to go up, to those next levels?
Yeah, there are different, I don't want to say tricks, but there are different plans to approach your VO2 max or your fitness level. One, as you can see, your VO2 max here being at 42, we're talking about kilograms per minute. So your weight is also a factor there. So weight loss potentially can also just directly impact your relative VO2 max based on weight. Now we can also look at the absolute VO2 max, crossing your weight out of the equation. Now we're really purely looking at how much oxygen is your body consuming. And now this test for you, for example, was done on the bike. So again, different machines are different type of testing. If we were to put it on the treadmill, you might do better. Or yes, and a cyclist definitely will do better on the VO2 max biking than he would do on a treadmill. So those are just easy things to kind of first take note when we're doing those tests. And then second, how do we actually improve our oxygen efficiency or capacity? And that's really is going to be, again, the comprehensive approach of healthy nutrition, good exercise, and good recovery. Because, again, if you're doing too much of one of those or not enough of any of those, we're not going to have adequate results. And so too much sleep or not enough sleep will have a negative impact. Inadequate nutrition will have a negative impact, and inadequate training would also have an inadequate impact. The best one is really going to be what is going to stimulate performance, and it's going to be increasing your heart rate, because we know as we're providing more effort, that's where our heart rate goes up. And this is when we're utilizing probably more muscle mass at this point, and that's where we have higher oxygen consumption. So getting your body trained to higher effort, higher heart rate. And so usually I would say that the most common exercise will be a high intensity interval training type of exercise. But now we can also put aside the strengthening that, comes around it, because you could injure yourself trying to provide efforts. You want the right structure in your body. So strength exercise is important, and the other part is flexibility exercise. So the yoga, the Pilates, even though it's also becoming mainstream, there's, I think, a lot of science behind it and benefits to the body.
One thing that the report flagged is so I usually, I mean, I guess it's an excuse, find it hard during the week. So in the weekends, I usually go at least once or 2 days to a spinning class, and I go pretty hard. But it flagged it that, it notices that I go hard, but then I only do it 4 times a month, right? That I should be doing it a couple of times a week in order. So how, beyond the going to the max, consistency and repetitiveness is also an important factor. How do you see that?
Agreed. So consistency, and so the Sports Medicine Society usually recommends anywhere from 120 to 150 minutes of exercise every week to different intensities. And so, I mean, you doing, I want to say the 120 to 150 minutes, let's say everything on a Saturday and not doing anything else the rest of the week is probably not as good as doing 20 to 30 minutes every day of the week, right? The frequency and the toll that it puts on your body is completely different dynamics there. And so, yes, the frequency is going to be important. And over time, it's not, we know that there's going to be periods of time in the year where you might be in better shape than others, but you want to keep that over periods of years, right? So you can't just say, I was in great shape for 6 months and then just be out of your routine for 6 years. You're losing any kind of healthy benefits that you might have gone there at that point. As much as we can talk about muscle memory and those kind of things, those are things that are built over a certain period of time. So what I like to tell my patients is looking for healthy habits, routines that are, number one, sustainable over time, because I could put you on a plan and a program for 3 to 6 months that you will tell me, okay, I could do it for 3 to 6 months and then done for the rest of my life. And that's not the goal here. The goal is for you to integrate that as part of your routine. So as you mentioned, you're someone very busy, and most of my patients are, and in today's society, I think we're all very busy with all the responsibilities. And it's really finding that earlier time in the morning where we're not sacrificing too much of our sleep duration or time during the day, if it's our lunch break or coffee breaks, really find something that we can integrate into a routine that is sustainable over a long period of time.
To wrap it up and to give people a little bit of actionable things, I'm going to ask you a couple of your thoughts on a couple of things. And, what do you recommend, to incorporate, and how much, cold plunges? How do you see it? I mean, these are things that I have a cold plunge. I was really into it. I honestly haven't been using it lately. Again, maybe another excuse. I do have a question there, because obviously, personally, I felt it very important mentally. It was almost like a mental challenge to go and oversee it, and listen to Huberman. But people say anti-inflammatory, right? And just common sense. And I honestly didn't research it. I felt being 1 or 2 minutes in cold water doesn't seem very anti-inflammatory for me. It probably needs more. So I actually stayed about 10 minutes, to really help. But how do you? First of all, does it even make sense? I mean, because in order to be anti-inflammatory, my guess is you need to stay there long enough for that to impact your body. And what other benefits does cold plunging have?
I do love those biohacking modalities, cold plunges, the saunas, infrared, and again, we were just talking about sustainability, consistency, frequencies, right? So again, you're not going to get much benefits from doing 120 or 150 minutes exercise one time a week. Same thing as you getting on the cold plunge 10 minutes once and just not going back again. I think the consistency and frequency is probably more where the impact is going to be. Also since you're asking specifically about the cold plunge, is also the timing of it. If you're doing it, pre-workout, post-workout on the recovery day, it's going to have different impact. We know that exercise itself is pro-inflammatory, but in a good way. We are creating, changes when you do strength training. We are causing muscle breakdown at the same time, but to create growth. And so same goes with the cold plunge, with the sauna. It has detox, it has anti-inflammatory properties, but again, it's I want to say very complex. It's not an easy answers to give. Everybody's going to need different plans that are going to be individualized to their own goals. Just to give you an example, cold plunge could be anti-muscle growth in the sense if you're going to go after your heavy workout where you've been pushing, it's going to restrict that muscle growth that you were trying to create.
Even for a minute or two.
Even for a minute or two, because you're really kind of causing vasoconstriction, right? The cold really decreases the vessel size, decreases the blood flow to the area that you've just caused or stimulated increased blood flow there. On the other hand, if you were to go into a hot plunge or a jacuzzi or a sauna, then you're causing even more vasodilation, more blood flow to the area. So that would have an opposite effect there. So I like the cold plunge more for recovery and the sauna potentially more for performance enhancement in a sense. But if you look at the bigger picture of things, recovery is still part of performance enhancement.
Correct. Well, I think it's been very insightful. Thank you so much, Dr. Camper, for your insights, and thank you for helping me with some of my own geekiness and data gathering, and hopefully we're gonna be doing a lot of really interesting things together.
Anytime, yes. Looking forward to more.
Thank you so much for another episode of Augmented Wellness. I'll be sharing something cool that we're probably going to hack together here as part of our goal of always sharing some type of actionable code base or something you could use for your own health journey. Thank you so much.